Good afternoon, listeners. Thank you for joining us on today's Healthy Community. I'm your host, Rebekka VanNess. Our show aims to improve health literacy by offering resources and information that strengthens and supports the wellness of individuals, families, and the communities in which we live. Today, I have the great pleasure of welcoming Mr. Raúl Torrez, who is the District Attorney in Bernalillo County here in New Mexico. He was sworn in as District Attorney in 2017 on the 1st of last year. He was born and raised in Albuquerque, a former federal prosecutor and senior advisor in President Obama's Department of Justice. He worked for nearly a decade in various positions, U.S. Attorney, Assistant and Assistant Attorney General, and Assistant District Attorney. He's worked at every level of criminal justice in our system to protect our community and try to fight for families to ensure that children grow up safely. He has handled some of the toughest cases in both state and federal court. So in 2009, Obama appointed him to serve as the White House Fellow and Special Counsel to the Deputy Attorney General of the United States, where he represented the Department of Justice in a variety of criminal justice issues, including trying to reduce southwest border violence. Prior to his career, he helped start up a company dedicated to good government and served as the development officer for the Cesar E. Chavez Foundation. He's been on a multiple of number of bar associations. And to finish up his bio, Mr. Torrez graduated from Harvard University. He received his master's degree from the London School of Economics and attained his law degree from Stanford. He currently lives in Albuquerque with his family. Wow. So I just want to give a little bit of a precursor to our listeners today. Mr. Torrez, I had the great good fortune of hearing you up at a conference in Albuquerque, I believe it was last November, where you talked about mental health in the penal system. And I was so fascinated at the innovative kind of approach and your position and all of the information that you had about this topic and how it really affects population health and the quality of life for the people who are going through it. Can you talk to me a little bit? I know adverse childhood experience is something that comes up a lot. Can you share with us some insight into your feelings about this whole topic and what you're working for and what you're excited about?
Sure, Rebecca, and I really do appreciate the opportunity to talk to you and to talk to folks across the state who are interested not only in public health and juveniles, but also the criminal justice system, because there's a lot of intersection between what we see day in and day out in terms of what is driving crime and some of the long-term frankly, institutional failures that we have with regard to not only addiction, but what we increasingly see is this large population in New Mexico of traumatized children. And, I think in terms of coming to this place, from my own perspective, it really started when I was a line assistant in 2005 and 2006. I was a child abuse prosecutor. I was a major case prosecutor in Valencia County. And one of the things I kept seeing over and over is the patterns that would link the histories of especially the really violent offenders that we saw as adults. Every time we go through the process of sentencing someone in New Mexico, you get what's called a pre-sentence report. And that pre-sentence report is the biography of an offender's life. And what you would see whenever you would go to sentencings for people who were convicted of really serious offenses is this theme of early childhood trauma, emotional neglect or abuse, physical abuse, sexual assault, the presence of an addicted parent or guardian in the house. Again and again and again, you would see the impact that those adverse childhood experiences had on the course of this person's life. And I think a lot of times when we think about public safety and we think about how we're going to build a safer community, we tend to focus on what the police and prosecutors are doing right now to deal with a specific crime. And that's our job, and that's what we focus on most of the time. But what we fail to do is we fail to think about the fact that what is going on in the courtroom when you get a conviction is actually the last phase of a story that's been underway usually for years and years and years. And what I mean by that is if you look at the people that are in the criminal justice system, what you see again and again and again is a high incidence of what we called adverse childhood experiences. And the link between early childhood trauma and subsequent dysregularity or impacts on behavior, your ability to cope with stress, your ability to form loving, supportive relationships with other people. And effectively, you set people up early in life when you don't intervene and look at that trauma early you have people that eventually, without timely interventions or real care and concern, you're going to see a high number of those people come back and escalate over time. And so when I took over as district attorney, I didn't want to just focus on what we were doing today to punish and hold accountable those people who are committing crimes. What I was really trying to do is think about what we can do for tomorrow, for the next generation, to prevent this. Because ultimately what you want to do is you want the phone inside the district attorney's office to ring less. You want to be in a situation where you actually need fewer police officers, not more, and fewer prosecutors, not more, because you've shifted resources upstream to make timely early interventions and, frankly, less costly interventions to save lives and to give people really a fighting chance to be productive members of society. And so that's sort of the basis for how I got to thinking about what we can do differently inside the criminal justice process. And we're really just at the beginning in terms of scratching the surface about what we can do. But there's a lot of opportunity, I think, to realign the criminal justice system, the mental health system, and a lot of the other institutions to really work collaboratively to start building a safer community.
Yeah, I agree with you wholeheartedly. I actually ran several group homes in some really challenging, rough parts of Los Angeles, and I would read the case files, and they were very similar. And it seems that sometimes the offense is actually a symptom of this conditioning into perhaps it could be even long-term generationally instilled conditions within a family and within a neighborhood where maybe they don't have the resources and they don't have those loving relationships and those connections. And so I think it's taken time. It takes time for kids to grow up. And like you said, these things go on for years. I think that there's an opportunity here now if we are mindful about it and focused on it. It may take time, but I think that we can change the consciousness about how our penal system works and how all of these things are so closely connected.
Yeah, no, I think, you're absolutely right. Especially, you see this again and again early, especially in the juvenile context. There was a recent study done on the presence of adverse childhood experiences in the juvenile population here in Bernalillo County.
Is that the Adobe Project?
That's right, and it was a study that was done by Dr. Cannon, or professor at the law school, and Dr. Andy Shee, a professor at the medical school. And what they did is they examined the kids that were in juvenile detention, and they found this extraordinarily high rate of adverse childhood experiences among that population. Just for example, 100% of the females that were in juvenile custody in Bernalillo County had been, had suffered physical neglect, 90% emotional neglect, 90% divorce or separation, 60% had a household member who was incarcerated, 77% had a household substance abuse issue. And the most astonishing figure of all is when you looked at the males and the females in that population, 75% had been exposed to 5 or more ACEs. of the males, and 87% of the females had been exposed to 5 or more ACEs. And what we're learning from new work and studies on the impact of ACEs is that the cumulative effect of early childhood trauma really has a compounding effect on people's ability to, again, build the kind of mental and emotional infrastructure that they're going to need in their life to succeed. And what we've also seen is that we can mitigate some of that harm if you make timely intervention. And the great thing about the study is that Dr. Shi then looked at that population and said, well, what can we do differently? And what they're doing with the Adobe project is they're having healthcare workers that go out once a juvenile has been released from custody, and they not only treat that juvenile for some of the psychological and emotional and mental health issues that they have or addiction issues that they have, but it's a 2-generation intervention model, meaning that if a parent or a guardian is also suffering from addiction issues or mental health issues, they enroll that person in the program and get them connected to services. And I think it makes a lot of sense to do that because it's not enough just to help those kids who have suffered early childhood trauma. We've also got to do what we can to stabilize families. And it's showing a lot of, I think, promise in its early iteration. What we're trying to do is see what other things we can do to try to stabilize at-risk families. And that's one of the reasons I got involved with the United Way of Central New Mexico. And their new initiative was called Mission Families, which is to go out and identify destabilized homes and at-risk kids and see what we can do to send social services into neighborhoods and knock on those doors before the police are called, before an ambulance is called, before there's an overdose in the home.
Sure.
And see if we can connect those parents and kids with services, and again, keep kids and keep families out of the criminal justice system and out of the ER, because that's what we ultimately need to do.
I just want to share a couple of facts that you had. You sent me a lot of information, and then we're going to go to a quick break, Mr. Torrez. People should know, this is so interesting, researchers in this project identified the childhood experiences as being positively correlated with the subsequent development of a wide range of chronic physical and mental health disorders in adulthood. And they were also identified as risk factors for chronic disease in the future. And so we're going to take a quick break, and we're going to come back and talk to Mr. Raúl Torrez, District Attorney for Bernalillo County, here in a minute, talking about juvenile diversion and mental health. Thank you. Welcome back to today's Healthy Community, listeners. We appreciate you joining us. Today we have Mr. Raúl Torrez, who's the District Attorney for Bernalillo County here in the state of New Mexico. And we were talking about, we're talking today about juvenile diversion and mental health. But most recently, before we took our break, we were talking about the Adobe project and how UNM and Science Center and the School of Law and the District Attorney's Office came together to look at ways to help at-risk families navigate social and economic hardships that can ultimately impede their health. Mr. Torrez, please continue. I'm just loving the information that you're offering the listeners today.
Sure. What we're doing now is we're looking at the Adobe project, but also with Mission Families through the United Way, we're actually taking a step back and recently starting to look at Department of Health data. Tom Sharman is an epidemiologist, works at the Department of Health, and one of the things he's been able to do is to map by census tract the presence of these same types of early risk indicators for at-risk families and at-risk kids. And what we're going to do is layer that information along with information from other public health sources and also the criminal justice system to try to create a comprehensive picture of specific, not just communities, but neighborhood by neighborhood. Where are the hot spots in any given community where we can see a dramatic need for public health services, after-school services, mentorship programs, and a whole variety of other low-cost interventions that we can have, because we think that if we make those targeted investments up front early on, over time you're going to see a real return on investment.
Absolutely.
And hopefully less reliance on emergency medicine, medical services, and also the criminal justice system in terms of what we're trying to do is figure out ways to stabilize these families where they are, where they live, and connect them to services at the population level. Now, the challenge is to integrate all of these different data sets, and that's something that's really exciting from our perspective, because we've never used, for example, criminal justice data in this way and layered it with public health data and information so that we can get a comprehensive picture of the places that we need to make. We need to think differently about what it is that we're doing. And it's really exciting. It's challenging. It has a lot of complexity in terms of navigating the legal requirements for confidentiality, the technological side in terms of making the systems communicate with one another, and then the service delivery piece, which is, okay, now that we have this information, what are we actually going to be able to do on the ground? So we're in the very early stages of that. But I think fundamentally we're on the right track with Mission Families, because it's very much a data-driven approach and something that hopefully we'll be able to build a comprehensive picture first in Bernalillo County, but eventually of all the communities across the state, and say this is, the specific neighborhood, the specific street that you need to focus on, and you need to focus on these types of individuals and provide these types of services. If we do that in a sustained, systemic way, you should start seeing, I think, a rejuvenation and a rebuilding of those communities from the ground up.
Yeah, and I am so supportive of your statements about getting those social supports and social services in place. I think that, innately, I think that most all human beings are really good people, and everybody has something to contribute, and everybody has skills and talents. And if that self-esteem isn't there, if their coping skills aren't in line, if they don't know where to look for supports when they need it, it seems logical that it would tend to lead to, what do they say, idle hands become tools of the devil or something. Well, maybe it's not that bad, but the fact is these families suffer, these kids suffer, victims of crime suffer. And so it just seems like such a wonderful way to lift up an entire community by supporting those that we might otherwise compartmentalize or label as bad kids, and they're really not.
Right. Well, and what's interesting is when I have conversations in the community, I interact with a lot of folks who ask me what they can do to help. And usually what they mean is, how do we help you with the backlog of felony cases, and how do we help you with the filing system, and what can we do to make the DA's office work better? And I think sometimes it's a little surprising when I tell them, let's figure out the closest mentorship program in your neighborhood, or let's figure out how we can help give rides to kids that have never been to the dentist or never been to the doctor, or who are struggling in school. Because what we're fundamentally trying to do is turn the trajectory of life for so many thousands of kids before they ever get to us. Because in many respects, a lot of times, especially when we see people as adults, our ability to effectively rehabilitate folks is limited. And so what we're trying to get people to understand is, if you really want to help build a safer community, you should focus on how many police officers and prosecutors there are and what the criminal statutes are. But you have to think about ways, and leaders need to think about ways to connect that spirit of community service. Because no matter where you live and no matter what your ideological sort of preferences are, there are people who want to help and are willing to help and willing to connect in their community. But a lot of times they just don't know how. And so I think the role that we can play is, this is what is needed, this is the program that can make a difference, and this is where you need to go to make a contribution. And so if we can start building that infrastructure and that network, I think you're going to see really, really powerful outcomes over time.
Yeah, and I agree, too, with what you were saying about it being an investment. And as we make this transition from our perspective on the penal system and how it works and what the opportunities are, I think about all of the money that could be saved over time as we start to see a change in the tide and a change in the number of juveniles having challenges and getting into trouble. I think about all of the money that could be put towards increasing those social services, after-school programs, vocational training, helping kids even understand how to apply for college. Not that anybody in their family may have even thought of that before, but it seems just like a wonderful way to lift everybody up and provide a way of looking at it that has not really been focused on before, and I think is just so appropriate.
We spend just so much money. I mean, it's about $45,000 per year per inmate for every person that we have to put in prison, without taking into account the cost for police officers, prosecutors, judges, public defenders, and all the other infrastructure that's required to investigate and prosecute criminals and to incarcerate them. And look, there's always going to be a need for an active, smart, energetic criminal justice system. But the question is, how much of this can be prevented in the first place? And we can't just think about punishment. We also have to think about prevention. And that's part of the reason I'm also really excited about an adult diversion program. It's called the Law Enforcement Assisted Diversion Program, LEAD. It started in Seattle. It's been working now a little over, I think, 3 years in Santa Fe. And it allows frontline police officers to take nonviolent offenders who have an addiction or mental health issue and divert them immediately to treatment without putting them in the traditional criminal justice system. And what they found, interestingly, is a dramatic reduction in the recidivism, the rate at which they come back to the criminal justice system. Mm-hmm. In Santa Fe, they saw a 34% reduction in the number of bookings in that population, wow. And they cut the amount of money that was spent on each one of those diverted individuals nearly in half.
Yeah.
So, the recidivism rate is cut by a third and the cost is cut in half. And this is still a relatively small program. We're trying to get funding and the infrastructure in place here in Bernalillo County. But I can tell you there's a lot of people that get into the criminal justice system who are not violent, who have mental health or untreated addiction issues. And what we end up doing is when we throw them in jail, a lot of times we put them next to violent, more accomplished criminals, and we tend to, make things worse oftentimes and not better. We leave their addiction untreated by and large. We drop them back in the community with a felony record.
And tell them, don't get into trouble.
That's right. And we have to be smart about what our expectations are going to be by taking someone who has now a felony record, a whole new expanded skill set of criminality, new associates that you don't want them to be associating with, and that untreated addiction issue, and putting them back in the community. The outcome is predictable in terms of the number of times they're going to be rearrested and reoffending. And we've got to have the courage to say, okay, what can we do different in terms of thinking about how these people can be turned around? And not everyone can be. I mean, I think I think we're all realistic about the limitations, especially with regard to deep addiction issues, opioid addiction, heroin addiction. It's very difficult, but we've got to try. And I think LEAD is a promising program, and we're waiting to see if funding is approved in this last budget. I know it was included in the budget that's before the governor now. I've personally spoken to her about keeping that in the budget, and if that program gets underway, it's something that I think it's just going to give us another tool in the toolkit for trying to reimagine the criminal justice system.
This LEAD program, we've got about 4 minutes left, Mr. Torrez. Can you tell me the kinds of services that the LEAD program is offering to its clients?
Right. So what they do in the model, the most comprehensive model is the model they've got in place in Seattle. That's the oldest one. The key component is to have a dedicated wraparound social worker and services navigator for each one of these clients. Because what needs to happen is there's not a one-size-fits-all approach in terms of the types of intervention that certain people need. Some of it is simply housing. Sometimes it's communication. Sometimes it's giving people access to transportation. And then on top of that, you have to have specific either mental health treatment options available or addiction treatment. They can do Suboxone, methadone, and also have some health care management for their basic primary care needs. And there's sort of a menu of options that the social worker and the healthcare navigator can direct these individuals to. And if they're coordinated in a certain way, they can make sure that at least those folks know about what is available to them. And one of the most interesting pieces is the impact that housing has on outcomes for people like this. It's probably not surprising to most folks that the lack of just basic housing is one of the things that really drives the inability for folks to separate themselves from those social contacts that reinforce whatever addiction or mental health issues they have. And something as simple as helping them connect with affordable housing can have a dramatic impact.
Well, and basic things like getting an identification or putting a living address on an employment application. If you don't have a place to live or call home and hang your hat, that alone is an enormous challenge for folks who are trying to reintroduce themselves and engage in their communities. I think we're down to just the last couple of minutes, and I know that you all have some some strategies through your crime strategies unit. Can we wrap up here in the next minute or so and maybe give us a little information about that? And if there's any links or information that people can find online, we love to share that with our listeners.
Sure. So one of the things that we've done is created a brand new unit called the Crime Strategies Unit. It's actually been used to great effect in New York, San Francisco, and major cities across America. It's primarily an enforcement tool that helps us identify high-impact offenders, hidden criminal networks, or hotspots within a community so that we can really narrow our focus on the people that are having an outsized impact on crime. However, the same data-driven tools that we can use to identify high-impact dangerous offenders can also eventually help us identify those people who are good candidates for diversion.
That's great.
Good candidates for an alternative path in the criminal justice system. We're building that now, and it's just in its early stages, but I think it's a really promising development.
Well, gosh, I could go on with this conversation with you for a long time. I look forward to seeing you again. And if you ever have an opportunity to see Mr. Raúl Torrez speak, he's an incredible speaker, and he has just a wealth of information. We're going to have to wrap it up today, Mr. Torrez. Thank you for joining us on today's Healthy Community. I'm your host, our producer, Justin Blanton. Thank you to the radio show and station manager, Kyle Johnson. And until next week, everybody stay happy and stay healthy.